Okay, and welcome back, everyone. I want to thank you again for joining me this afternoon for a webinar. The topic is safety, contraindications, precautions for low-level laser therapy. My name is Dr. David Kanashko. I'm a chiropractor. I'm the Director of Education and Research here at Meditech. We manufacture and we use in our clinic here BioFlex laser therapy. A bit of housekeeping before we get started. If you have any questions with respect to the webinar, I will be answering questions at the very end of the webinar, so please type them in and I'll get to those at the end, as I mentioned. If you can't hear, you're having difficulties listening in, or perhaps even if you have to leave early, this webinar is being recorded, and it usually takes a few days to a week or so for us to edit it and then put it up on our support page on our website. So you can also listen to it again if you didn't catch everything. I've also put in quite a few references in today's webinar that you might not have time to record, so these will all be available on the edited version on our support page. Okay, so let's get started. The reason why I want to cover this topic is, of course, we do this in our basic certification training, and many of you have probably already listened to lectures on this, but there's a bit of new information, a bit of research I want to present to you guys out there. So I think it's interesting, number one, to refresh your memories, and number two, to hear some new and latest research or input on safety and contraindications of photobiomodulation. First, I'm going to talk briefly about the differences between laser light and LED light with respect to their safety profile. And then we'll get into contraindications, precautions, and no precautions or no concerns. I'll talk about my references at that point. And then briefly, I'm going to talk a bit about laser therapy and cancer, laser therapy and treating children, and laser therapy and tattoos, which I thought was a really interesting topic because I read a paper not too long ago where there was a case study on this exact same topic. Then I'll do an update on photosensitive medications and how they may apply or not apply to laser therapy. I'll then bring up some frequently asked questions and answers that we oftentimes get here in the clinic, just to share those with you. And then if you have any specific questions yourself, I will take those up. And lastly, if you happen to be in the Calgary or Alberta area, maybe even adjacent province, we're having a training coming up in a few weeks, and we do have a discount code. So if you care to listen in, we'll give that code at the very end, and you can save some money if you're on the fence about attending. This will be a bit more incentive to join. Okay, so with respect to photobiomodulation, there are two efficient ways of producing photons of light that are going to cause an effect. Essentially, laser diodes and LEDs are the most common sources of light that are used. And of course, in our equipment, we combine the two of these. Recall that the difference between a laser diode and an LED diode in some respect, they're pretty similar, but in other respects, they differ with respect to divergence. So on the left, you can see that laser light is all coherent or monochromatic, so the waves are in phase. So in other words, if I have a 660 nanometer laser diode, all that light is going to be emitted will be that specific wavelength. However, on the right, with respect to a light-emitting diode, especially ones used for photobiomodulation, they're what's referred to as narrow band LEDs. So in other words, the light will be close to 660 nanometers. In fact, most of it will be 660 nanometers, but there'll be a band of maybe 5 to 10 nanometers on either side of that wavelength. So in other words, the wavelength could be perhaps 650 or 670, with the vast majority or average wavelength being 660 nanometers. And the light coming out of LEDs, again, is monochromatic. However, they're not in phase. So in other words, a non-coherent light. Okay, so coherent light, laser diode, non-coherent light, LED. LED have a very safe profile with respect to ocular damage or eye damage, and essentially that's because, as I just mentioned, LEDs emit divergent wavelengths of light, and again, they're relatively low power. Most LEDs are anywhere from 1 to 40 milliwatts. They tend not to be much higher power than that because they start to heat up quite a bit and they actually burn out the actual diode. So therefore, they're relatively safe to view with the unprotected eye. So when you're using our equipment, you don't need to protect the eyes against the LEDs using the arrays. The only time that we do say to use the safety glasses with the LEDs or the arrays is if you're using the arrays very close to the face or the eyes. Although that light won't harm the eyes, it is very bright, and that patient might find it quite uncomfortable. With respect to lasers, again, this should be a review for many of you out there. They're essentially classed according to the eye injury hazard, and that has to do with the power output of the lasers, starting from a class 1 to 2 to 3R. Those are lasers that emit anywhere from 0 to 1 milliwatts up to 5 milliwatts. And then class 3B lasers, where you'll find most laser devices for photobiomodulation. Class 3B are rated from 5 to 500 milliwatts. And many of you are aware that once you get to the threshold of around 500 milliwatts, that's where you start to have heat being produced, which means that you start to have a thermal effect. And then you start to broach into class 4 lasers, which are above 500 milliwatts, and you start to have heat being generated, and you can start to actually burn tissue. Class 4 lasers are typically used for, or referred to as ablation lasers, and they are used for surgery, procedures like LASIK eye surgery or other procedures using lasers to cut skin. So again, perhaps a review. Is the electromagnetic radiation that comes out of these types of devices harmful? Well, first of all, we need to understand that there's two ways to cause damage with respect to electromagnetic radiation. One has to do with ionizing radiation. In other words, is there enough energy in the waveform to break bonds, specifically covalent bonds in DNA? And this, of course, can cause mutations, especially over the long term, that can lead to cancer. So one example of that is ultraviolet or X-rays exposure over periods of time or excessive can lead to skin cancer or other forms of cancer. In the early days of X-rays, when early radiologists were using their equipment, they were using their hands a lot to calibrate their equipment. So they'd actually be X-raying their hands in order to make sure that they were calibrating the energy efficiently. And of course, they weren't quite aware that this X-rays were harmful, and many of those early radiologists ended up with cancer, especially of their hand, bone cancer and so forth. So we definitely know that ionizing radiation is harmful. In the cases of non-ionizing radiation, which of course where laser therapy falls in, it can also potentially be harmful if it's intense enough. So in other words, if the power of that specific light is higher. So think of microwaves or think of infrared heating lamps where as the power increases, you can actually cause a heating effect, whether it's food in a microwave or an infrared lamp, to heat tissues. So the main safety issue with lasers, of course, is ocular eye damage. And this has to do with the fact that, of course, the lens of the eye will focus all types of light to the back of the retina. If the light happens to be coherent in nature, that is a laser beam, then this laser can actually be magnified. So think of the sun being magnified by a magnifying glass. And this can be focused on the back of the retina, which can actually cause damage if prolonged or enough power emitted to the lens itself. So that's the main concern with respect to using laser diodes that are above the 5 milliwatt to 500 milliwatts. Most lasers under 5 milliwatts aren't considered overly harmful to the eye. So if you think of like a laser pointer, that kind of thing, they tend not to be, you don't need to wear protective eyewear with those lasers. However, as you get into the threshold of 3B especially, that's where you need to have special eyewear. So the safety glasses are specified according to the wavelengths used in every, for the specifications of that medical device. So our equipment, we use 660 nanometers and 830 and 840 nanometers of laser light. So that means that you need to make sure that the glasses that you're wearing to protect your eyes protect against those specific wavelengths. So remember that everyone in the room where the laser is being used should be wearing the safety glasses. So if you have a patient with a family member, a child or what have you, they should also be wearing eyewear when the laser probe is being used. Or probably what's even better is ask those people to leave that area during the laser probe portion of the treatment. Okay, so I'm going to go over Physiotherapy Canada. This publication is electrophysical agents, CIs, and precautions with respect to using these types of modalities in practice. They go over a lot of different types of modalities. Of course, I'm focusing here on low-level laser therapy. So what I want to first talk about are contraindications. So in other words, these are areas where they don't recommend the use of laser therapy. So tissues infected with tuberculosis or other forms of virulent bacteria. Laser therapy is not considered necessarily to propagate infections. However, it can increase circulation, so you do need to be careful with respect to treating around infected areas. However, some research has indicated that because of the immunomodulation effect, it can help to some degree with fighting infections. But again, a lot of this work is done in vitro, and the standard is still considered not to treat an infection. You don't want to treat around the lower back or the abdominal region during pregnancy. We don't know the effects of photobiomodulation directly on a growing fetus, and therefore it is considered a contraindication. Remember that you can treat away from that area, so if a pregnant patient's come in with a knee problem or a shoulder problem, you're still okay to use laser therapy. You just don't want to treat directly over that growing fetus. I'm going to talk a bit about this more in depth with respect to malignancy, but we currently feel that it is a contraindication to treat over a known area of malignancy. However, I will give you some up-to-date information on this topic, which I think for a lot of people is quite relevant when patients come in. It is considered contraindicated to treat over actively bleeding tissue or patients with untreated hemorrhagic disorders. Again, this has to do with the vasodilation effect of laser therapy for obvious reasons. Similarly, for regions with active deep vein thrombosis or thrombophlebitis, it would be considered a contraindication. And as I mentioned earlier, you don't want to treat directly using laser therapy on the eyes. And this is interesting because there actually now seems to be some good research on using photobiomodulation for treatment of certain eye conditions, like macular degeneration, even retinosa pigmentosa. However, they're not using coherent light. They're using LED, so non-coherent light. But again, most equipment, in fact, all equipment is not designed to treat the eyes. So avoid treating the eyes until there is specific equipment used for those types of conditions, which will probably be coming out in the next few years. And of course, that would be used by ophthalmologists and optometrists or people with expertise in that field. Physiotherapy Canada also says not to treat directly on reproductive organs, specifically the testes. Again, they're not quite sure of the effects. However, again, this is one of those questionable contraindications because I've seen research for treating patients over these areas for reproductive purposes with positive results. Again, however, these are specialists that are familiar with the effects of light on those organs. There's some research to indicate that it can increase the motility of sperm, increase fertility as well in women. This is all kind of more experimental, some research coming out. But currently the guidelines by Physiotherapy Canada, which probably will be updated soon, consider this a contraindication. Okay, as far as precautions go, so essentially you can elect to treat patients with these conditions, just perhaps maybe use lower intensities or with a little bit closer monitoring. So as far as treating patients that have recently radiated tissues, for example, for radiation therapy, that kind of thing, You can treat those patients. In fact, it's used a lot for oral mucositis in patients that have had radiation therapy to treat oral cancers quite effectively. But again, they're monitored quite well. Patients with photosensitivity disorders or systemic lupus. Again, this is one of those conditions where I think they've put this out there because these patients can be sensitive to light. You need to be careful with these patients, but it's not considered a contraindication. We've treated patients before with lupus. You just need to probably monitor the dosaging and make sure the dosages are perhaps a little bit lower than normal and see how the patients respond. But there's no indication that it's detrimental or will cause issues with the actual disease process. Patients with infections who have compromised immune function. Again, this is a precaution, but not necessarily a contraindication. Here we treat a lot of wounds with patients that have infections and so forth. We know that laser therapy can actually improve the immune function, but again, it has to do with the infectious process and being careful. So unless you're a specialist or have that in your scope of practice, I wouldn't suggest using laser therapy for that. In patients with cognition or communication impairments, sufficient to prevent them from giving accurate or timely feedback. And that really has to do with the fact that anytime you're doing any kind of procedure with a patient, you need to understand if there's any issues going on with that patient. Although laser therapy having very few side effects and not causing any heating, it is considered quite a safe type of therapy. So this type of precaution is one that you can still go ahead and treat the patient. Treating children, I'm going to mention that briefly and some research on that. Over the active growing epiphysis is considered safe. There's really no research to indicate otherwise. Treating directly over the anterior neck and the carotid sinus. We do treat around the anterior neck and even around the carotid sinus with no issues. Again, just being careful and monitoring. This has to do with the vasodilation effect of light therapy. But again, it's not considered a contraindication. Okay, patients where it's considered safe to use, for example, tissues infected with non-virulent bacteria is okay. Areas with impaired circulation is fine to use. Areas of impaired sensation, again, because it's not causing a heating effect, it doesn't pose a problem. Obviously, areas overlying regenerating nerves, this can be very helpful. Patients with hypertension or cardiac failure, areas overlying electronic devices like pacemakers and so forth, that's considered safe. Again, remember this is light energy, not electrical energy. Treating over intact skin, over implants, whether it's metal, plastic, or other types of chemicals like cement or so forth. Tissues inflamed as a result of recent injury or exacerbation of chronic inflammatory conditions. Areas of damaged or at-risk skin, for example, of chronic wounds and so forth. And again, skin overlying the active epiphysis. I'm not really sure why they said it twice. They had a precaution directly over an active epiphysis. I mean, obviously you're going to be treating the skin over it, and it is considered safe. Okay, so that is with reference to Physiotherapy Canada and their status on using laser therapy. I wanted to talk briefly about laser therapy and cancer. This reference is an editorial by Jan Tuner. You can see the website at the very bottom of your page. I suggest that everyone go to it and read what Jan Tuner has to say about this topic. Quite informative. Jan Tuner is considered one of the world experts in photobiomodulation. Remember, the wavelengths used in laser therapy are not in the ionizing range, as I mentioned earlier, and therefore they're not going to break covalent bonds and directly cause cancer like ionizing radiation can. The general rule is not to irradiate over known areas of malignancy, as I mentioned earlier, not necessarily because laser therapy will stimulate malignant cells, but because we don't really know enough about this. And I'm going to talk a bit about some research that Jan brings up. So what about irradiation over unknown areas where malignant or pre-malignant cells are hiding? That's a question that we get asked quite a bit. And the answer here is that there's not 100% certainty in this area. Light seems to have an effect on malignant cells and pre-malignant cells to some degree. However, this is in vivo and in vitro. However, it also has an effect on the immune system, which seems to counterbalance, in fact, tip the scale towards immunomodulation than any negative effect it would have on cancer or pre-malignant cells. So laser therapy has indeed been extensively used for the treatment of side effects of cancer treatment. I mentioned this earlier with respect to mucositis after radiation therapy and lymphedema after mastectomy. So it is widely used. In fact, it's now part of the evidence-based guidelines for treatment of these side effects of these cancers, a treatment for these cancers. So we know that it is considered safe in these patients. Essentially, these patients have been treated under the surveillance of oncologists and have had no reported negative side effects with respect to these research trials. And there's quite a bit of research on this. Jan, and I'm going to show his references at the end, has mentioned some of them, and there are even more on PubMed if you wish to take a look at them. So the concern is that even after radiation and mastectomy, for example, some malignant cells would still be present, and therefore, what if they're stimulated by laser therapy? However, there haven't been any research or reports found that, in fact, this is the case, that laser therapy could trigger those cells to reinitiate the cancer process. In vitro research is inconclusive, with some tumor cells stimulated by laser therapy and others are not stimulated by laser therapy. Remember that in vitro studies essentially are in vitro. They don't have an immune system, a functioning immune system. They're talking in a test tube. So therefore the in vivo situation can be quite different. Jan goes on to talk quite a bit about this and gives some really good references, so I suggest that you read that as well. According to Jan, quote, from both in vitro and in vivo analysis, we can state that laser therapy is effective in boosting a potent immune response in vivo. And my conclusion, this is from Jan, is that malignant and pre-malignant cells indeed can be stimulated by laser therapy. However, there is a simultaneous stimulation of the greatest healer of them all, our own immune system. So some of the research that Jan is referencing here talks about some in vivo work done showing benefits of using low-level laser therapy in cancer. However, we're so far away from using it directly in cases of cancer. The question really is, will it cause a negative effect in these patients with cancer? Jan believes it won't. However, the jury's still out, still research being done, and for the meantime, we still suggest that this is a contraindication to treat directly over areas of known cancer. However, you can treat patients that have had cancer in the past, and I'll talk a bit about that at the end. Here are Jan's references. I certainly don't expect you to scribble them down. These will be available on our website, on our support page when this webinar is rebroadcast, usually within a few days to a week of today's date. Okay, as far as treatment of laser therapy in children, oftentimes the issue is more, will it have an effect on the growing bones? A research paper in 2012 was looking at the use of red light on the epiphyseal growth in rats, and you can see the reference below. They used, as I mentioned, 6-7 nanometers. They used different energy densities from 4, 8 to 16 joules. Remember that typically humans, LLT for humans uses 4 to 8 joules per centimeter squared. They looked at 21 rats aged 4 weeks. After radiation of the tibia, the right tibia, then they were kept for another 14 weeks of age and then submitted to radiological examination, and they evaluated the limb length over time in comparison to the placebo or the control side. They did a histological analysis of the growth plates as well, and the comparisons were made, as I mentioned, with the untreated left tibia. So no differences were observed in any of the reviews, either radiological or histological, when comparing the right sides, which were treated, to the left side, which was untreated. So it was concluded that the treatment with LLT within parameters used caused changes neither in the area of the epiphyseal cartilage nor in the final length of their limbs. Okay, this is, I thought, really interesting. I saw this paper not too long ago. So first of all, we need to understand that there's quite a few people out there, just in case you've been living in a closet, that have tattoos. The latest stats, well, not latest, but from 2006, so I'm sure it's even higher now, that approximately 36% of people between the ages of 18 to 25 years of age have tattoos. So you can imagine now in 2017, that percentage would probably be even higher, and the age group above that even quite substantial as well. So I read this report last year, and references using LLLT on a patient that had a tattoo. It was it was a case study by a physiotherapist. 23-year-old white male, Caucasian, was treated for complaints of chronic left shoulder pain using 10 joules of centimeters squared of LLLT using a cluster probe. They used gallium aluminum arsenide laser, very similar to what we use. Also some LEDs. They didn't actually name the device, the manufacturer, so I'm not sure what it was. They said it was provided 500 milliwatts of light. Now I'm not sure if that's total combined, which I assume it is, as opposed to each diode producing 500 milliwatts, which, as you know, is the threshold of heat anyhow. So I can only assume that it was a total. And the wavelengths they used were anywhere in the infrared range from 760 to 1000 nanometers. So within seconds of applying 10 joules, the patient complained of a burning sensation under the laser head. The technician or the PT checked the patient's skin. It seemed okay, so they reduced the intensity to 8 joules, and then they continued the treatment. However, the patient continued to complain of burning sensation again, and the treatment was then discontinued. Total treatment time that was logged was 2.15 minutes, during which time the patient received essentially 8 joules per centimeter squared on average. Here's a picture of the tattoo. You can see it's black and white photo, but it was apparently, according to the article, a very dark ink, blue-black kind of ink. And then I'm going to zoom this so you can see. A little hard, at least with definition, but you can see the skin. I hope you can kind of see there's a center, almost a bullseye, where most of the heating effect occur, and around it there's some erythema and some blistering and a minor burn. So the authors go on to speculate that the adverse event of a blister occurring over the black tattoo in response to standard laser treatment of pain may have been caused by the metal salts in the pigment of the black tattoo. You may or may not know this. I do mention this in the training, that pigment compounds used in tattoos are not officially controlled, so the organic and chemical compound of the pigments aren't necessarily readily known. Frequently, pigments are mixed, adding several metal salts to the compound, and metal salts like cadmium sulfide can have an adverse reaction to light and can cause an edematous reaction. So the dark pigment may have caused an increased absorption of emitted photons, while the metallic content of the pigment may have further amplified the intensity of light energy. So the authors surmise that this increased intensity may have resulted in an accidental overheating of the pigment's metal salts, resulting in blister formation of the overlying skin. So the takeaway lesson here is be careful when using the laser probe directly over a tattoo, especially dark ink of a tattoo. Make sure that if you treat around that area, that you're not treating directly over that dark ink. Okay, a bit of update on laser therapy and photosensitive medication. This is a review of evidence. I do mention this, I think, in training, but a little bit more detail. What you see here are a series of drug classes like antibiotics, chemotherapy drugs, diuretics, hypoglycemics, NSAIDs, and so forth. These medications as a whole are photosensitive. However, on the far right, if you look in the red area, you can see that the wavelengths that they're sensitive to all fall essentially within the ultraviolet A or B spectrum. Or even slightly above or slightly below that, but essentially not in the wavelengths that are going to be used in standard photobiomodulation, which typically are 630 plus nanometers up to about 1,000 nanometers. So the authors concluded that the mechanism of drug-induced photosensitivity does not overlap with the wavelengths used by lasers in medicine. This is supported by the lack of case reports describing laser-induced photosensitive reaction in a medicated patient. Therefore, there's no described reason that patients on photosensitive medications should be refused laser treatment. Okay, I know we're half an hour in, but just a few common questions that I've received. Polycystic kidney disease, stage 3, glomerular filtration rate 21. Can laser therapy be used safely on organs, specifically the kidneys, to reduce inflammation and improve kidney function? If so, are there any recommended protocols? Okay, so first of all, we don't have protocols for these types of conditions, as you're probably all aware. Should you be treating the kidneys? Well, there's probably no harm in treating the kidneys. However, there's also no research indicating that will have any specific positive reaction. I have talked to some researchers and even have read a bit of research that it may in fact be helpful. However, it's the goal here is not to be treating a kidney disease directly. Using laser therapy. We don't know if it's going to be helpful. We certainly don't have any protocols. So really here is, are you qualified to be treating kidney conditions? And if so, then that might be an option. But unless you are a specialist like that, I don't recommend that. Question 2, a breast cancer survivor 1 year post-treatment. Can laser therapy be used safely on breast tissue damaged from radiation? If so, is there a recommended protocol? Okay, so I mentioned earlier that oftentimes we treat lymphedema. So we do have a lymphedema protocol secondary to mastectomies due to breast cancer. Working with the oncologists and the doctors, typically we wait until the patient's in remission, and then we go ahead and treat lymphedema. There's quite a few randomized control trials that do the same, and it seems to be quite effective. So again, every case is different. However, you do need to make sure that you're working with the oncologist, and you also are familiar with the protocols for lymphedema and are familiar with the evidence-based guidelines that are published on this topic as well. Question 3, cerebral palsy-like symptoms, born with underdeveloped cerebellum, male age 14. Can laser therapy be used safely on the occiput cerebellum region to potentially improve functioning? If so, are there recommended protocols? Again, we don't have protocols for these types of conditions. We treat all the time around the occiput and cerebellum, treating the neck, that kind of thing. So we know it can be safely used in that area. Will it help cerebral palsy? In fact, it may. There's a few studies to indicate that it may be helpful. However, this is very experimental. We've had some of our users use it on these patients, some positive effects. It is safe to use. So it's one of those types of questions that, yes, you can go ahead and try it, but we're not still quite sure what kind of positive effect it might have. Question 4, multiple sclerosis lesions in the brain. Can laser therapy be used safely to reduce inflammation in the brain? If so, is there a recommended protocol? Again, no protocol. We have treated multiple sclerosis patients. I'm sure many of you out there have as well. We usually treat the cervical spine and or thoracic and lumbar spine to stimulate the central nervous system. We've actually seen quite dramatic positive effects. There's a randomized control trial on MS as well. However, you're dealing with indirect treatment to the brain and the central nervous system. It's very difficult for me to say if it would have an effect on reducing inflammation. However, based on our own clinical anecdotes and some of the research out there, it may be a helpful way of improving symptoms of patients with MS, but not necessarily, obviously, to alter the progression of the disease. Osgood-Schlatters disease, age 12. Can we treat over this growing epiphysis? Again, if you were paying attention earlier, we know that you can safely treat those patients. Question 6, patient diagnosed with Hodgkin's lymphoma, age 55. Can we safely reduce pain and inflammation secondary to OA of her knees? Again, we feel that treating a specific area in a patient like this is safe. So even though it's a blood-borne cancer in isolation, and the dosage used, it shouldn't be any contraindication. But again, all the doctors and oncologists should be aware of this treatment before it's done with their approval. Patient has a pacemaker. Can you treat their shoulder? Again, remember earlier I mentioned it's safe to apply this equipment and laser therapy to patients with embedded electronic devices. How soon should you be applying laser therapy after an injury? So recall earlier, if there's actively bleeding tissue, you shouldn't be treating it then. However, once it's coagulated and things have stabilized or starting to heal, you can start to treat. In the case where there's no, no obviously actively bleeding tissue on the surface, you can treat, and I would say probably an hour or two after an injury would be fine. I wouldn't apply it immediately right after. In other words, 30 seconds, a minute, 2 minutes. Give it a bit of time for the acute inflammatory process to be initiated, and then proceed with treatment. Question 9, a patient has arm lymphedema after mastectomy surgery. Can laser therapy be safely used? And again, this sort of is similar to the previous question, that yes, you can treat these patients and it seems to be quite effective. Oh, I guess I'm just repeating myself. How soon should I apply laser therapy after an injury? I think I answered that already. A patient had a cortisone injection after a right shoulder tendinosis. Can laser therapy be safely applied, or should I wait for the cortisone to clear? Again, the evidence here is kind of sketchy. There's not a lot. Some suggest that you should let it clear for 24 to 48 hours. Others say that it might actually be helpful to treat right away with laser therapy. We haven't really seen any net negative effects using laser therapy right after cortisone. The effects may not be as great as you want, but it's certainly not. I don't consider it a true contraindication. Patient presented with SCM strain. Do I need to be cautious when treating near the thyroid gland? Again, I don't think I really mentioned that in the CIs by Physiotherapy Canada, but you do need to be careful treating over the thyroid gland because we don't know the direct effects. We do know that it can potentially increase the metabolism of the gland, and therefore you do need to be careful when you're treating the SCM or anterior scaleni or anterior neck musculatures. Okay, those of you who are interested, we do have a masterclass in training November 17th, 18th. Is their masterclass, or is a training November the 19th is their masterclass. The coupon code used the word safety to save $50 off each event, whichever one you choose. Hopefully you choose both to attend. You have until this Saturday at noon, so 48 hours essentially to save this, and hopefully a few other people can join us in Calgary for a good event. We do have quite a few speakers, outside speakers, including Dr. Eleanor Stein and others, along with myself and Slava, that will be speaking at this event. All right, so I'm going to see if there's any questions out there. I know I'm running over time. I don't know how many of you are still listening. I think quite a few. So let's take a look at the questions. Okay, any contraindications when treating patients with autoimmune diseases? So with patients with autoimmune diseases, I mentioned like systemic lupus, that kind of thing. It's considered a precaution, not necessarily a contraindication. You just need to monitor it, and you need to, essentially be careful, but it's not considered a contraindication. A patient who is lying face down on the table and there's no space with the face against the face rest. Right, so if a patient's lying down, prone, they don't need to wear their glasses when you're treating their lumbar spine. That's a question. Okay, since there was a television show highlighting the work of Dr. Khan, that was on CBC, The Nature of Things, in which Dr. Khan was treating some brain issues, and that we were told not to treat the brain as this is still experimental, like epilepsy and etc. So clients have been asking about treating headaches and so forth, and place arrays on the forehead. Okay, so let me just back up a bit. This work treating brain disorders like post-concussion syndrome, dementia, Alzheimer's, Parkinson's, and so forth is still experimental. There have been ongoing randomized control trials and case studies. We don't believe the effects of treating over the cranium with photobiomodulation will have any negative side effects based on the history of using laser therapy over any other area. We do not, however, have regulatory approval to guide our clinicians on how to treat these conditions. It is considered safe to treat in and around the neck, the base of the skull, and so forth. We treat directly on the cranium when we're treating TMJ, sinusitis, some other conditions around the face. So it's not like we don't treat over the head area. But specifically, if you're looking to treat those brain disorders, like I mentioned previously, that's something that you as a clinician have to decide on yourself with respect to if the patient's willing to try and for yourself to kind of essentially experiment with your own protocols. Right now, though, it is considered experimental, so we can't guide you with respect to that. As far as contraindications go, again, it's not necessarily mentioned that it's contraindication to treat around the calvarium, and it is quite frequently done. Everything from hair loss to some of these other conditions I mentioned. So hopefully, Jill, I hope that answers your question. How long after mastectomy and removal of some lymph nodes can we treat for lymphedema? Really, that question has to do with if they feel the patient's in remission and they've been tested and they feel the patient is now essentially out of the woods. So that the timing would depend on that communication with the oncologist and their family doctors. Can you share what those improvements to MS were? What about Parkinson's? The patients I've treated with MS were patients in wheelchairs or having ambulatory issues, and they all showed improvements with respect to that, being able to ambulate better, even being in a wheelchair with and being able to ambulate afterwards. Again, just to emphasize that the patient had some ability to ambulate but was in a wheelchair a lot of the time. So we've seen improvement in motility and movement. In Parkinson's, it's a more challenging question to answer. We've seen some improvements with respect to cognitive function, executive cognitive function, memory issues to some degree, but probably not as much as improved executive cognitive function like awareness of their surroundings and so forth. Can you use stem cells and laser in combination? That's a really good question. I have seen now several papers on the use of laser therapy in conjunction with PRP and stem cell injections, finding it actually better to use the combination of the two. A question by Jerry White. Hi, Jerry, out in British Columbia. So currently, I would say yes to that. And in fact, I think it would be very helpful to do the combination of the two. Okay. Someone didn't like a question. Can laser be used for erectile dysfunction where the tissue is low blood flow? If so, where to apply? Yeah, so you saw earlier that technically they say it's a contraindication to treat over the testes. But I've seen some anecdotal information about treating directly over the penis with respect to ED. I don't know. I don't have much data on that. Jerry would ask Slava. I think he's treated some patients for that, apparently with some good success. And I've even seen some devices on the market in Asia using laser therapy. So it may be helpful with regards to that, but I don't have a lot of information on that. Let's see here. What about treating tinnitus and migraines? Sandy, if you can email me that question. RE the tattoo, if there had been several diodes, I would have expected more bullseyes. Right, so I'm not really sure. I didn't see the device, so I can't comment on, you're right, I would have expected to see more bullseyes. So I'm assuming it was one diode and then multiple LEDs. I'm not sure though. Effectiveness for spinal stenosis. We've actually had really good results with spinal stenosis, Jeff. If you care to email me, I can discuss that further. So Jan, in fact, it may have been one 500 milliwatt diode, if that was the case. I'm just not sure because they didn't mention the manufacturer. Any contraindications for porphyria, a blood-borne disease? Not that I'm aware of. And can laser be used in prostate? We have treated over the prostate gland for inflammation. Slava has done a lot of that work with positive effects. Where on a scale of 1 to 10 would you say experimental treatment of the brain lies? Boy, that's a tough one to answer. We're still far away, but getting closer every day, so probably 3, 4 out of 10, but that's just a ballpark. Okay, guys, lots of questions here. Do you treat nerve damage in the mouth as a result of dental implant? Our equipment is not designed to treat intraorally, Ruth. However, dentists use intraoral applications for that, for nerve damage. And can you treat a focal nodule in the prostate? Again, Kofi, I'd suggest you email Slava. His email is slavamd@bioflexlaser.com. All right, thanks everyone for attending, and we'll see you next month. I'll put the list of the next webinars on the website next week. Thank you.